All right, good evening, everyone. How you doing today? I'm Dr. J here at Imagine Wellness Center, guys, in San Antonio. Welcome. Tonight, I am going to be talking about inflammation and autoimmune. The question is inflammation part of your autoimmune disorder? Is it part of your autoimmune disease? And I'm going to bring specifically of what's going on with you. We're going to get serious to really know what is autoimmune disease. How is this horrible disease and diseases per se? How did they come about? What can we do different? Right? Because right now, there's no solution for autoimmune disease. You are taking some medications and some treatments for your symptoms, but in reality, there's no cure for autoimmune disease, guys. Well, welcome. I am going to bring some light to the end of the tunnel today of what can we do? What can we do for your body to restore itself? How can it heal itself? And guys, it is amazing. I know that I've worked with lots of people with autoimmune disorders, and we know how they've gotten better. So again, guys, welcome. I appreciate you guys tonight to give me the opportunity to educate you, to talk to you a little bit, and bring in a little bit more of information for you on this autoimmune disease, which is really a huge topic going on right now because the more and more I'm seeing a lot more people with autoimmune disorders. All right. So again, myself, we jump in going on with the autoimmune, talk about the physiology and function. Where is the autoimmune? Where is that inflammation coming from? And how is it systemic inflammation? Is that a big issue in what's going on with you? Which it is. All right. I am a doctor of chiropractic. I do not do any chiropractic in my office anymore. I completely concentrate on functional medicine, chronic disease, not just autoimmune. We deal with a variety of different autoimmune diseases. But at the end of the day, my wake-up call came when my grandmother passed away from diabetes. That's when my cross of my roads mostly is that my father and mother were diabetic. Were they going to be just like grandmother and passed away? She did. A really horrible day, a horrible way. It was not. I didn't want that. So that's when I went back to school. I did 3 years of the Diploma of Internal Disorders. I lived in Spain for about 3 years, really learning a lot about functional neurology, functional endocrinology. I came back to the States and started working with my parents and started dealing a lot more functional medicine, helping people with autoimmune disorders, especially diabetes with my parents. I did awesome with them in this whole process of their diabetes. But one of the things that I dislike was this, and I know you're going to relate to this because a lot of the times what we do in today's healthcare and how they teach us and how every doctor's been taught is about finding the symptoms and really giving you something to decrease those symptoms because they gave you a protocol to a name of a disease. And organic or not, that is our concept. And I found myself doing the same thing over and over again with my patients without even doing, talking about, giving natural substances for the purpose, right? I was just giving them to a symptomology. My parents were taking about 5, 6 different supplements to decrease their sugars. What's that? Is that the solution? Giving her another substance, just substituting the metformin for an organic one? Yeah, less side effects, and we think that we're doing better. But in reality, guys, that is not the concept of healing. When are you going to heal? When are you restoring? Are you tired? I've taken medications over and over again, changing medications, and yet we're still having the problem. If you're taking medications for the last 3 years, 4 years, then where am I going, right? What are we doing here? Am I recovering? Is my body restoring? And that's what's going to be about tonight. I'm not here to sell you a supplement. What I am here, though, is to educate you and tell you there is a process of our bodies to recover and heal by understanding what system is out of place. The biggest systems in which you're going to recognize, and we're going to talk about here in a minute, is that it's going to be my digestive system, my endocrine system, my neuroendocrine system, and my circulatory systems. I believe that a lot of those systems are out of place, and how they integrate with each other is really, in reality, how you're going to get rid of your symptoms and your disease. And we are going to talk about inflammation. Where does inflammation come from? And how is this inflammation creating my autoimmune disease? I am a true believer that if I can decrease that inflammatory responses, you're going to see a big change in the way in your symptomology and all your blood work, how your attack is going to be decreasing. So again, this is what we're going to be really talking tonight. For a lot of you guys that are just joining us, welcome. Inflammation. Is inflammation part of the autoimmune disease? And most definitely, I believe so. And I'm going to talk about it, how that works. Okay, guys? Now you know a little bit about myself. We're not strangers anymore. One of the big things that I love to do with my presentations is that this is live. Okay. If you please on the chat get involved with it. I love talking. I might answer some questions if I do have the time. Let me know your name. Let me know where you're from, what part of Texas, outside of Texas. We work with patients all over the nation. So I would love to hear from you. That way it makes me feel like I'm speaking to somebody. And that way we can even get, even answer some of the questions that people might have and that they might want to hear in how it's going on. So again, let me know your name. Let me know what city you're from or what state you're calling us from or you're joining us from. And then from there, we'll talk about it. There is. Thank you, Houston. All right. Thank you very much for complying. First one from Houston. I have a lot of patients from Houston. We work a lot in the Houston area for sure. Again, thank you very much for answering and thank you much. So all of you guys, don't be afraid. All right. Stephanie, awesome. Sahara, awesome. From Dallas, Houston, Terry, Belmont, phenomenal. Terry, Lisa, Columbus, Ohio. All right. So we got somebody from Columbus, Ohio. Welcome, Lisa. Thank you very much for answering. Daisy, Houston, phenomenal. Welcome, Daisy. Again, guys, thank you very much. Also, as I go through this process, I want to know a little bit about what diseases you're dealing with. What is your autoimmune disease? Because there's over 80 different autoimmune diseases, and there are really some really, really bad ones out there. That way I can kind of talk a little bit more into that process, all right? Lisa, welcome. Awesome, let's be here. Irene, welcome. Excuse me, Cheers Houston, I'm sorry, Irene. Belinda from Dallas and Terry. All right, Terry's dealing with lupus, fibromyalgia, no problem. We'll talk about that here in a minute, what is going on. But we're going to be talking about, remember, root of dysfunction, root cause. What is causing my problem? Okay, I'm not interested to talk to you about a medicine that's going to decrease your inflammation. I'm talking about how is my body creating systemic inflammation, and that is very, very important to understand. And how can I restore my body so my body can really help itself? All right, so let me get started. Let's jump right into subject. I'm gonna download my slides a little bit here and let's get started, guys. I want to jump into educating you and understanding what is the root cause of your autoimmune disease and is inflammation the big issue, and where's this inflammation coming from and how can we control it? Not only that, what can I do for you? How can I help you? How can we change the direction where you're in right now where there's no hope, right? Because it's autoimmune disease. Okay, so again, awesome. All right, so all right. Again, guys, I am Dr. J from Imagine Wellness. Welcome. My office. I'm from San Antonio, Texas. But again, like I said, we have a system online that we work with patients all over the nation. All right. Now, remember, this presentation is going to be talking about the physiology and function. How is autoimmune, and what can we do for it? It's going to be very important through this process. If everything that I talk about makes sense to you and you want to have a consultation with me, I'm going to give you an opportunity once you go through the process and what we do. Okay, and if everything makes sense, then I would love to do a consultation with you. I will give you an opportunity. In fact, I will give you a very decreased price in the consultation to make it easier for you to see if what we have here has a good fit for you and how can you reclaim your health on a disease that right now is uncurable. And we'll talk more in detail within that. I am going to give you a discovery call. I know I have a discovery call, which is we call you. It's a 15-minute call in which you might have other questions that might proceed to a consultation, or just if we have a good fit, can we help you with that? Have we seen that? Of course, we can always look into that for sure. All right, guys. So again, we do have that, and let's get started. Let's talk about autoimmune disease. All right. So let's get rid of all distractions. I always like to start by that. If you're not using your phone, just put it on silent. Let's get a pen and paper, and let's write down what's going on with your health and what you can do with this. All right. So let me begin by talking about inflammation, right? My question to you at the beginning here was, is inflammation my autoimmune? Is inflammation part of my disorder? Is this causing my own defense mechanism to attack itself? Because that's what autoimmune disease means. It means that your defense mechanism has gone crazy and is attacking variety areas of your body. If it attacks joints, rheumatoid arthritis. If it attacks your muscles, fibromyalgia. If it's gut, Crohn's disease. If it's your thyroid, it's Hashimoto's Graves disease. So on and so forth, right? Eczema, psoriasis, right? So again, there's a lot of different diseases that you might be dealing with that could be the dysfunction. But what is going on here is that my defense mechanism has become confused and it's attacking itself. I'm going to talk to you about how that's happening, right? And what is it that we can do, right? How can we restore your systems, as we spoke about earlier, for your body to recover? So it's very important. So Systemic inflammation. The first thing in the way I look at systemic inflammation is where is my systemic inflammation? Where am I creating so much inflammation within my body that's giving me my disease? Because obviously it's not trauma, right? Nobody's hitting you on the head every 5 seconds to create inflammation, right? So where is this coming from? Systemic inflammation. And most likely your digestive system is playing a huge role into your inflammatory responses. Now, I don't know if you ever heard of the term leaky gut or permeability of your gut. That term right there, we're going to go over it specifically because it is affecting you. And to me, your foods, listen to that, your foods, regardless of its nature or its value, okay, it is going to be the big problem here. Your foods, I'm going to talk about how your foods can create such high inflammation in your body, especially when they're coming into your system on a daily basis. Okay, so we are going to talk about leaky gut. That's going to be what systemic inflammation, where does it come from, and how is such high inflammation is creating my autoimmune disease. But before I do that, I want you to understand that your digestive system is huge. Okay, again, what happens? What controls my what is my digestive affecting? And just kind of give you a little bit of a, quickly, just a little understanding of how important your digestive system is affecting everything, your sinuses, your mouth, your adrenals, right? Your joints, right? Rheumatoid arthritis, fibromyalgia, right? It's creating brain, the ADHD, right? All these problems in the neurotransmitter dysfunction. It is affecting your eczema, psoriasis, right? How about thyroid? It is huge. And I can almost guarantee you, some of you guys here tonight have an issue with the thyroid, in which I'm going to explain to you, because the thyroid effect, or the thyroid hormone, affects every cell of your body, right? Which includes inflammation, right? So again, we'll talk about that in detail, how important that is. And again, the lower and the large intestine is also affected. So again, this is how your body and your digestive is working. And if that system is not working, then you're going to create dysfunctions in these areas, which most of you guys are probably already affected by. Now, let me jump right away into this leaky gut syndrome, right? So remember, the concept of autoimmune, to me, in the way I want to help you, is to understand that your digestive system, especially the small intestine, has created permeability of your gut, microscopic holes in which your foods are leaking through, and it's affecting my blood, and it's creating autoimmune to my foods. And those inflammation from that food is what's creating a lot of what? My diseases. Now, that's just an overview. Let's talk in specifics. What is going on with me, doc? What is going on in my health? And above all, my doctors are just giving me medications just to sustain my symptoms, but in reality, they don't give you any hope. And there is no hope. There is no hope for autoimmune disease. But right now, I know that I'm going to provide a lot of hope for you, because again, I'm going to explain it to you. So, okay, the destruction of the lining of the gut. Okay, what has destroyed the permeability or the lining of my gut? Okay, that actually the barrier that controls the external world of my digestive system with the blood flow in my body. Now, the lining of your gut is going to be composed of mucosal cells. All right. Again, that there's going to be certain triggers, right, in which most of you guys have these problems. Triggers are destroying the tight junctions, the glue that holds my cells together. They've been destroyed, or my cells have been destroyed by these triggers. And I have some up here so you can know which ones they are. Dietary proteins, low hydrochloric acid and enzymes, antibiotics, infections, sugars, right? Antibodies, pregnancy, not just chemicals. Now we're talking about hormones, pregnancy. How about stress, cortisol, right? Menopause, toxins, food allergies. So these are the root of dysfunction that destroys the tight junctions of my gut, which gives me, okay, if you guys are dealing with any kind of digestive imbalance, bloating, gas, hiatal hernias, acid reflux, diverticulosis, right? You're dealing with ulcerative colitis, Crohn's. You might be dealing a little bit with, IBS. You might be dealing with hemorrhoids. All these different dysfunctions is all about what? Disruption and inflammatory responses from these triggers. We need to identify those triggers, and it's okay. But the damage that have they done already in destruction of this lining of the mucosal cells is really the beginning of the problem of how your body is going to create inflammation from your foods. So now let's zoom in, all right? Understanding that there's reasons why your gut has become destroyed. Let's zoom in and let's talk about how this little slide here is causing a lot of inflammation in my body that's giving me a lot of my diseases. Now, let's say that I eat a food. Let's take it again. It doesn't matter of nutrient value. It could be spinach, onions, gluten, dairy, eggs. It could be beets. It could be kale, it doesn't matter. Whatever leaks through there is what your body is going to attack. So it's not about nutrient value. This brings me back that this is the reason why when you do all these different diets, right? You're doing, I don't know, inflammatory diets, right? You're doing keto diets, right? You're doing all this eliminating diets. What is my body getting? How is this? And diets are not working for you. It's because you're really not identifying the true essence of what your body's fighting. You're just guessing. And again, that's the reason why you haven't found what? Relief, right? So therefore, if I eat a carrot, let's talk about a carrot being healthy, right? I love carrots. I chew my carrot in my mouth, it breaks it down, it goes to my stomach. Its acid breaks it down further, it goes into my small intestine. And then my carrot is made into these particles of nutrients, right? And it's getting absorbed through this villi. Okay, those little fingers like you see here, microvilli and villi. That's where all this food is absorbed and is putting into the cell, carries into the blood, and is taken to wherever my body needs it as a nutrient. That is my carrot. That, in small words, is a transportation of all these different foods that you're eating is a normal absorption. But what happens if my particle of my carrot, okay, leaks to the permeability of this gut and it lands in my blood? See, that's the biggest problem we were talking about earlier. The connection from the dirty world of my digestive system to the purity of my life, which is my blood. Your body, God's created a system to defend itself and keep that blood clean at all times. So when something like this lands in my blood, my body needs to clean it and get rid of it. So what is it going to do? It's going to flag it. There's going to be two ways of attack. Okay, again, guys, it's a little bit more complex than this, but I want to make sure you understand there's two ways of attack. Okay, you're going to have these cells. Let's call these cells T cells. And all these cells do is monitor your blood flow. Define this carrot. Remember, they don't know it's a carrot. It's a bad substance. It came in through the wrong pathway. We got to destroy it because it could be bad. So the cells come to this carrot and it puts a flag on it. It creates a memory. From now on, every time you eat a carrot, it comes with a flag because it's being flagged as a bad substance. Just like a virus or a bacteria or a parasite, whatever might come in, right? Your body flags it, puts a mark on it, and it creates a memory. That's called autoimmunity, right? So I just created autoimmunity to my carrot. Now, the second wave of attack of cleaning this blood in your life is going to be the killer cells. And these killer cells, all they do is they look for what? Flags. Any flag they find, they destroy. So therefore, when they get to this carrot, they destroy the flag, they destroy the carrot, you're going to activate a thing called the circulating immune complex. Now, this is really important because when you activate this system of attack, and your body's cleaning all this trash out of your blood. Right now, my carrot, my flag, what it does, it created inflammation. The first thing that it creates is inflammation. Are we talking about systemic inflammation, right? Are we talking about that inflammation that creates my body to attack itself? Most definitely, right? So again, what is inflammation? Inflammation is the first step to all disease. Inflammation is pain, right? So right now, I just created what? Inflammation from a carrot. Think about that. My digestive is so dysfunctioning, okay, that you create a permeability of your gut in which any food that you eat, you might create a flag to it. And I just created inflammation from my carrot. It crosses my brain barrier. Okay? It affects my brain. It affects my neurotransmitters dysfunctions up there, right? Then you're not getting the nutrients out of your carrot. You see how this is affecting you? Now, inflammation is what we're talking about tonight, right? Is inflammation part of your autoimmune disease? Yes. Why? How can my body become confused to attack itself? It's like this. If you right now are eating, because if I ask you where you eat, you most probably are eating the same foods every day. Different way of eating them. I mean, if you eat a taco and an enchilada, they're similar, right? There's still corn, there's still beef, right? And you're eating those foods every 3-4 hours, right? We're eating 3-4 times a day, right? Now, if your body's fighting, okay, 20 different flags, 20 different foods that you're eating on a daily basis every 3 times or 4 times a day, then you are going to create tons of flags in your blood. By creating tons of flags, you're going to create tons of inflammation, right? This is why you're so sick all the time. Now, if I have lots of flags, let's say my defense mechanism, right? My killer cells comes to destroy these flags. And let's say there's so many flags in my blood that it only destroys half of them. And let's say that the other half goes through my blood and they're going to land somewhere. And let's say they're going to land in my joints, right? So you got these flags in your joints. Eventually, your killer cells are going to come to kill those flags because why? They're bad. I need to get rid of them. Your body knows they're bad for you, so it needs to clean that out. So therefore, when that defense mechanism comes, the killer cells comes to destroy those flags in my joints, okay, how did it get confused to attack my joint instead of the flags? I'm going to give you a visual. If I plant a few rows of carrots in my garden and I go away for the next 4 weeks, I come back and I find my carrots full of weeds. I need to clean my carrots and I start pulling out my weeds, but before you know it, I'm pulling out my carrots. Why? Because I can't tell the difference. I didn't want to kill my carrot because they're not ready to be pulled out. See, this is what's happening in your what? In your joint. You're going to have flags, good cells, flags, good cells, flags, good cells. And when those killer cells come to destroy those flags, eventually it's going to be what? Killing those good cells in between, because just like me, I couldn't tell the difference. I'm pulling out my carrots, right? This is what's happening in your joints. If your body and those flags and your defense mechanism is attacking those flags in your joints, this is what you call rheumatoid arthritis. If these flags and inflammation and confusion of your body are sitting in your muscles, this is what you call fibromyalgia, okay? Psoriasis, eczema, right? If it's attacking your thyroid, it's called what? Hashimoto's, because they attack your thyroid, decreases the production, you become hypothyroid, excuse me, but it's called Hashimoto's and hypothyroid from an autoimmune, from the attack, those flags. If it increases your production, now you got Graves' disease. Woo, that is not a good one. So therefore, you just created hyperthyroidism, Graves' disease from an autoimmune attack. Again, there's over 80 different diseases in which this inflammatory responses is making my body to become confused to attack itself. And where did all this inflammation come from? It began in your digestive system. And it started to what? On the things that we really think that, like, especially in our foods, right? If you're getting up in the morning, you're juicing, for example, you're eating, I don't know, coconut milk with, spinach, cucumber, and pineapple, right? Ginger. And you throw that in there and you're drinking that every morning. But if your body is leaking and the flags come here with a ginger or maybe the spinach, right, or the cucumber, and you're creating these flags every time you drink this, you're creating inflammation because your body has flagged that as a bad substance. This is the reason why we got to clean that up. What can we do to help you, right? It'll be awesome if we can identify those flags, take those flags away, then your body has nothing to attack, then your body won't be attacking itself, right? Wouldn't you guys want something like that? Of course. That's what we're going to be doing. I can identify those flags. And if I can get rid of those flags, get those out of your diet, then your body has nothing to attack. Now you're what? You're no longer producing inflammation. It's giving the confusion to my body to attack itself. And it began from your digestive system, right? So let me trace back, right? In autoimmune, inflammation is the biggest issue in autoimmune disease, okay? All right, now, Sjogren's disease, Charisse, same thing. It's affecting your circulatory system. This flags is attacking the system, so therefore, that's where you're getting it. That's the inflammatory and dysfunction to that, okay? So it depends where those flags lands, right? If you're having diabetes type 1, well, you know what? These flags are in your pancreas and destroying those cells that produces my insulin. Now I got diabetes type 1. It came from an autoimmune attack, right? So again, awesome. Thank you right there for that. All right. So again, it's not we're looking here at what's going on with your inflammatory responses, right? Now, what destroys the lining of my gut is going to be those triggers that we just spoke about. There's no problem. We can identify those triggers and really identify what's causing the dysfunction that's giving you digestive imbalances. On top of that, we know how to restore and heal this leaky gut. There's no issue at all, okay? We can really restore this tight junctions and make your gut stronger. But the biggest problem for you is that I can fix and repair the digestive system, but if I don't identify those foods or those flags that you have, then you're still going to have the attack, right? Regardless of what foods you're eating. You're just not going to be creating new flags. So my objective here is to do a blood test that identifies these flags, get them out of your system, and now you have a system that is not creating what? Flags and inflammation. See, it's very, in a way, it's complex, but its simplicity is here in front of you. And most doctors will never talk about leaky gut, permeability of your gut. They will never talk about your foods being a problem. In fact, you've probably been to all these nutritionists that tell you, right, let's get rid of all these different foods that causes inflammation, but yet I'm still having my problem, right? We spoke about that. You can go to a lot of holistic doctors and give you a bunch of detoxifications and a lot of different supplements to identify and really heal this issue. But until you don't go to the root of the problem, okay, then you're not being successful in really reclaiming that health that you always wanted, right? Because right now we're talking about their digestive system, okay, being affected to the circulatory system. Did I talk about systems earlier? How those are intertwined together, right? So my digestive system is connected to my circulatory system. If I can keep those healthy by doing certain bloods and cleaning and repairing the systems, if I can get rid of those inflammatory responses, then you're going to get rid of your your attacks. If you don't have those attacks, then you don't have what? The inflammation and the antibodies you've been checking. See, this is when I see tons of results with my clients and how their life changes by just identifying this system. Okay, now I'm going to go quickly. Okay, this is very important here. But another system that I know that has really, you probably guys have this issue, and that's thyroid. I'm going to tell you specifically just quickly about thyroid because I believe that thyroid, remember, is the endocrine system. You see how I'm connecting this? Endocrine system, digestive system, circulatory system. But in the endocrine system, there's certain hormones that could be affecting you in the digestive and the process of healing. And thyroid is one of the most important ones. Now, the reason why I say thyroid is because thyroid affects every cell of your body. Listen to that. Your hormone from the thyroid affects every cell of your body. Okay, autoimmune inflammatory responses, no problem. We can help you with that and we can explain it to you. If you do get a consultation with me, I can really tell you specifics on how that works. But for right now, I want to talk about the thyroid because I said that the thyroid hormone affects every cell of your body. So quickly, I'm going to tell you some of the symptoms, all right? And if you are having thyroid problems, would you please let me know here on the chat? Just kind of so I know that I'm talking to the right audience, especially as explaining certain symptoms and dysfunctions to your thyroid, okay? So thyroid, losing hair, okay? Very, very common symptoms that you might be dealing with thyroid imbalances, all right? You're gonna be very tired, very sluggish, no motivation. You're gonna have mood swings, right? Happy one minute, mad the next. Some depression, definitely thyroid, all right? Insomnia, definitely thyroid. How about overweight? You can do all the diets in the world, but yet you don't lose that weight, okay? You can go through a starving diet, lose 10 pounds, and the next 3 to 5 meals, you're going to gain everything back because your problem is not about food consumption. Your biggest issue is that you don't have the energy in every cell for your metabolism to burn that energy. And that's what the thyroid hormone does, right? Your eyebrows starting to disappear, right? Your fingernails are weak. You have fogginess, can't think straight. Thyroid. If you are taking medications and still having these symptoms, it means that you misdiagnosed thyroid, which is the most misdiagnosed gland in the world. In my office, I believe that 95% of my patients come in, they have a sluggish or really a thyroid that's not working right. So again, that's very, very, very important. Okay, so again, Therese, thank you very much for answering to me. I like that, all right? Pamela, awesome, all right? Deborah, you have hypothyroid. That's really good. All right, so what I'm reading here, guys, is that, Deborah, I have thyroid, I have hypothyroid, many issues. We'll talk about thyroid here in a minute, okay? The next one is thyroid issues, overweight, okay? Therese tells us thyroid tests are normal, but have all the symptoms. And I'm gonna take it to the next step. And thank you, like I said, Therese, thank you, because I'm gonna explain to you why you've been misdiagnosed, how is your doctor looking at your thyroid, and why is it that I believe that your problem is bigger than you think, because your doctor's saying that you're normal, but yet you're not because you got all the symptoms. Same thing with the people who have been diagnosed with the thyroid, right? So if I ask Deborah, she has hypothyroid, what are you taking, right? Levothyroxine Synthro, right? Are you still having your symptoms? Yes, right? But your doctor says you're normal, but you still got the symptoms. So this is the reason why I'm talking about it right now, because it's misdiagnosed and it plays a huge role in your digestive system. It plays a huge role in all your health. This is the reason why I concentrate so great into this thyroid, because most doctors are misdiagnosing it. Look, let me quickly tell you how this works. When you go to your medical doctor or any doctor out there, they're going to check a hormone called the TSH. This is the thyroid stimulating hormone. Most of them, they gauge this of how your thyroid is working. Because if your TSH is high, it means that your thyroid is not producing. T4 hormone, thyroxine, is produced by the thyroid. TSH and T4 always work opposite to each other. TSH high, T4 low, that's a problem. You're in hypothyroid, okay? For some of you guys that are hypodiagnosed, they're going to give you a medication, which is a synthetic T4, right? TSH high, synthetic T4, it increases the T4, TSH drops, you become normal again, you're in the normal range, then your doctor will say, yes, you're in normal range, we're doing good, right? This is the solution for hypothyroid. Hyperthyroid works opposite to that. Your TSH is very low, T4 is very high. There's not a lot of medications to bring the T4 down. Okay, so what they're going to do is they're going to get rid of the thyroid. right? And radiating iodine. Why? Because right now your body's going 100 miles an hour, right? You got too much fuel in your system, in your cells. You got palpitations, eyes are bulging, you're jittery, you're shaky, all these different things, right? You don't want that. So by getting rid of the thyroid, you will have no T4 hormone. Goes opposite, right? Your TSH goes up, T4 comes down. Now you're in hypo. Oh, there's a solution for hypo, right? Giving you a synthetic T4 like levothyroxine, Synthro, or other compounded medications. The TSH drops, T4 goes up. Oh, you're in normal range. You're good. All right. This is how you've been diagnosed. But yet, a lot of you guys, they said, no, you're normal. Some of you guys are taking medications, but yet you still have the symptoms. Why? This is why. Oh, guys, I'm glad you're here. You're getting all this great information. We got to change your lives. We got to do something different than you're doing right now. All right, so listen, your T4 hormone is produced by the thyroid. This is your medication, right? Now, every cell of your body needs a T4 hormone, a thyroid hormone, but it's not T4. It's actually T3. And your thyroid only produces about 7% of that T3. So therefore, that T4 needs to what? It's inactive. Your medications, the levothyroxine and Synthro, is an inactive hormone. It's T4. It needs to be activated to T3. Where do we activate these hormones? Okay, you're going to activate 60% of that T4 to T3 in the liver, 20% of that is going to be in the gut, and 20% is inactive in reverse T3, or even it gets activated in other tissues. But these are the tissues that are most importantly in activating that T4 hormone to T3, because T3 is what makes my body go. That's what creates energy. That's what loses the weight. That's what makes my gut work better. That's how I get rid of inflammation, right? That's how itself. Your hormone is not there. A lot of you guys are dealing with all the symptoms because your doctor is saying that your T4 and TSH is normal, but your T4 is not being activated because you have high fatty liver, high cholesterol, you might have hepatitis, dysfunction to your liver. Then you're not converting T4 to T3. Can you have all the symptoms of hypothyroid even though your TSH and T4 is normal? Yes, you can. Same thing with the digestive system. You see, this is where I want to help you, right? Because we're talking about systems out of place. And right now, I'm talking about your digestive system. Now we're talking about the endocrine system, okay? So again, for some of you, this is what's going on in the whole digestive imbalance. This is what's going on in your thyroid imbalance. Because if you're already having autoimmune, you're already having digestive issues, right? And you might not be converting T4 to T3. Could that be enough to give me all my symptoms of hypothyroid? Yes, yes, it can be. So therefore, this is one of the huge things I always want you to remember that's going on with your body. But now let's talk about the thyroid. Why is my thyroid not producing? 90% of the time, in women especially, study shows that your problem is coming from an autoimmune disorder. Which is autoimmune what? Hashimoto's and Graves' disease. We just spoke about that. So 90% of the time, you're not producing your thyroid because we go back to your digestive. See, this is the connection that I'm trying to make for you, is that your body works with other systems and integration. If they're not together, then you're not going to create healing. And even if you don't have a thyroid, that T4 hormone needs to be converted to T3 through the digestive in the system. I can help you in understanding how can we clean and repair. We need to identify the root of the problem, right? Is it my pituitary? Is it my thyroid, my liver? Is it my gut? And overall, it's going to be autoimmune. Didn't we just start talking about autoimmune? Guys, this is what I'm bringing to the table for you. We have to do something different, right? So I'm explaining things to you because I want you to understand the root of dysfunction. Because if you don't understand it, if it doesn't make sense, then you're not going to move forward to understand that there's hope for you. And I know you're listening to me, and there's a lot of things going on. Oh, wow, this might be something that you've never heard before. So I'm bringing that information to you because I want you to start learning, to start thinking, and start taking care of your body instead of relying on a capsule or relying on a pill that's coming out or relying on something that's going to decrease my symptoms. It is time to start taking care of your body. And a lot of you guys have probably tried hard to protect and take care of your body, but it's not working. This is what we're doing here in my office, guys. Again, did this make sense to you guys? Did you guys learn something in the anatomy and physiology of function of the autoimmune disease and inflammatory responses, which is affected by your digestive system, that's affected by your thyroid? I want to make sure you understand that we have to look at the fundamentals and create a foundation to your health, because if you don't, you're always going to be floating around, going doctor to doctor to doctor, and yet you have no solution. Right? Because the healthcare system today is really not working for you. They're working for themselves. And that's what my next step is talking about. I want to motivate you to start thinking on your own. Because right now, our health crisis, right, is really in a sham. It's really, I don't know, corrupted. It has a lot of things going on right now that is not working for us anymore. You got this wrong lack of information, and all we're looking for what is having an insurance, and we think that by having an insurance, I got this safety net where my body's going to be taken care of. You see, it's not it, right? You've learned this. Some of you guys have insurance, and here you are with all the problems because they don't have any solutions. There's no cure for autoimmune disease. Then what does it mean if there's no cure for autoimmune disease? It just means that there's no pills for it. Didn't we just go over the systems that are affecting and how can we make that inflammation go away so your body can no longer attack itself? Because now itself, it needs to restore itself. I'm not telling you I'm giving you a capsule for it. We are going to give you substances to clean and repair, but with a purpose. But in the end of the day, it's all about the money. We are stuck in a system that is not working for us anymore. It's working for themselves. So I'm trying to tell you this. I want to motivate you. Life is really important to know that there's a purpose in your life. And here we are doing the same thing over and over and over again, expecting different results. If you're taking medications for the last 3, 4, 5 years, and if you're not getting any better and not reclaiming, not restoring, repairing, then you're just sustaining your disease. You're not getting rid of your disease. But here you are thinking that you are because you feel a little bit better, but yet you're feeling worse and then worse and worse. So this is me to you is saying that we need to start taking action. You need to start learning how to take care of yourself so you can rely upon you to be healthy. But in today's world of wrong and lack of information, you go to Dr. Google and you don't even know what to read anymore because half of them are giving you all these lies, half of them are telling you the truth, but yet nobody's stepping up to say, you know what, I want to teach you. You're going to get all kinds of, if you're really, I know that you're researching, that's why you're here. And you're researching all the others. You thought about, oh, you got to take this supplement because it's going to do this, it's going to do that. It's not the supplement, guys. It is talking about what systems are dysfunctioning. If you can restore those systems, you'll see how you can easily reclaim your health. And that is my job to bring that to you. Okay? Again, wrong information, lack of information. We need to talk about those capsules and all those pills you're taking. By the average American, you're taking between 4 to 5 pills per person. It is unacceptable. There's got to be something different for you guys. There's got to be something different. There's got to be light at the end of the tunnel. You cannot tell me that I have a problem and I got psoriasis all over my body. I got all these different autoimmune dysfunctions, and here you are telling me that there's nothing you can give me besides some, really strong pills with a lot of side effects that are really going to control my symptoms a little bit. And nobody talks about where's the root of it coming from. Where's it coming from? I'm giving you a lot of answers here tonight, guys, and I hope that this is making sense. I'm here to help. I have the heart to help because I know that in your life, there's a purpose for you. And for you to achieve those purposes, you cannot do it unhealthy. But to create health, you have to have why you want to do things. I want to stimulate your mind to say, I want to do something different. And I want to take a chance and really restoring my health by knowing what to do. And that way I can have the choice of staying healthy for the rest of my life or not. And that's what I'm bringing to the table for you. You need to get healthy. Again, I know that some of you guys maybe, don't know who I am, but I'm giving you a little bit, you probably already researched me. Let me just give you a few. There's tons of testimonials in my website, imaginewellnesscenter.com. And there's tons of things that we can, the people that have gone through that you might relate to, so you can understand what is the need, what the need here is. Penny came in with all kinds of autoimmune dysfunctions, especially Hashimoto's. They had nodules on her thyroid. They're getting ready to get the thyroid out because that was a solution. She had depression, loss of hair. I'm talking overweight. There's all the things that you would look at thyroid and autoimmune, right? Again, by identifying the root of the problem, healing and repairing certain system, which I'm going to tell you here in a minute how we're going to get that done. We have created a system that is going to restore your body so your body can restore itself. How much easier can we make it for you? It's just you taking the chance and understanding what that is. Okay, and I know that Penny came with her daughter. Her daughter was 9 years old, had with eczema, a lot of problems with sleeping cycles. We helped her quite a bit. If you see her on the testimonial room, this is what she's going to look like. 3 months later, 30 pounds off, no more surgery, strong hair. Her life was just changing dramatically. Why? Because we help her body restore itself, and that way it could heal itself. And that's what we're doing here. I'm trying to explain to you that it is hope for you, and if you give us an opportunity, we can make it happen for you. Now, again, that's the story, and you might be able to relate to her, and that's really in the effect, right? How can we get help? All right. So, Deborah, can your medications have a dramatic effect on your hair? I wouldn't know which medication you're taking there, Deborah. That's one of your questions that you have here. I believe that most of my clients that are coming into my office are mostly is going to be either you have hyperthyroid or hypo. Hypo will give a lot of like hair loss for sure. And then when you're induced hyper, some of my patients come in with medications that are too high and they're hyperthyroid by medications, also see their hair fall. Again, yes, we do have that. And if you are taking Synthroid, maybe the problem is not the medication, is maybe that your Synthroid is not converting to T3 and you're still in hypothyroid. Okay, you still don't have the T3 hormone to help your hair grow. That's what we need to find out. That's what I'm here for you. Okay. So great question, because maybe some other people were really asking on that too, wondering what that would be. So again, we spoke about T4 to T3 conversion, right? Gut and liver. And if you have Synthroid and your TSH and T4 is balanced because of your doctor saying so, and you still have losing your hair, it may be because that T4 is not becoming T3, and T3 is what's going to make that hair grow, right? So if you're not converting because you have problems in the gut and the liver, then you're going to have not only hair, you're going to have a lot of the symptoms that we just talked about. Okay. So again, great question, and thank you. Give me a consultation. We can get you healthier and really go to that problem. So let me quickly tell you about the fundamentals that I use in my office. That way you guys will know what I'm doing for you. Right? I got to create a foundation to your health. Without a foundation, there's nothing stands. Without a good foundation to this building where I'm at or your house, you will fall. Same thing with your health. Right now, you don't have a foundation. You're chasing how to restore your roof when you really, the fundamentals are not, the foundation is not there. This is the reason why you cannot get results. So I use 5 pillars of health, and I'm going to go over those quickly for you, so you'll know what you're to expect when you do come to my consultation, or what you should be working on. Okay, again, it's nutrition. It's not just about nutrient value, right? We made that clear, right? You probably read a lot about the great, powerful foods. To me, yes, those are awesome. But first, we need to really responses that come from the nutrient dysfunction. What are the foods that you eat and the body's creating the flag from that we just spoke about? Right? Once we identify those flags, we're going to get them out of your diet, right? But once we have to identify them, right? It's going to be a blood test. We're not guessing. This is not a muscle testing. No, this is me knowing. This is not guessing into this eliminating diet. No, we're going to know what's going on in your blood, and which is going to tell us. And that's how we're going to restore your nutritional value. This is not a cookie cutter. This is individualized to specific needs, because all of you guys who are listening tonight are not the same. So why would I want to give you the same way of eating? Okay, we'll talk about how that works and educate you of the best way you can do it according to your blood work, and how you can continue to really helping you with that, right? Because once we clean that inflammation patterns and you eat the good foods, now your body's absorbing what the right nutrients to create energy, right? To promote the growth and really repair all the tissue. That's how you're going to get better, right? But it's not just about your nutrient value. Most important thing here is that everybody is missing the inflammatory responses that comes from your food, from that permeability of your gut. Remember that. I got to work with that in nutrition. Is very important. We just spoke about the gut and the liver, how important those two are. We have to get rid of toxins. We need to know what's going on with the liver. We'll tell you a little bit. We have an awesome way. We've been doing this long enough to know what is the most common dysfunctions in your gut, what's the most common dysfunction in your liver, but not only that, what is the best thing to give you to restore that. We're going to get rid of a lot of the environmental, toxins and medicines and things like that your liver might not be working for. And we'll talk about genetics in a minute. So again, if that's not working right, you're not going to be working right. About hormones, right? I just spoke about thyroid, okay? But all the other hormones are still there. There's other hormones that be causing the root of your problem, especially like from your sex hormones. We didn't even talk about estrogen. We didn't talk about adrenal glands, right? Your circadian rhythms, right? We didn't talk about that, tiredness, sluggishness from that. Thyroid we spoke about a little bit, and then the liver, right? If you look at these body shapes, most of the time you can tell which hormone is out of place just by looking at the body shape. But again, we don't want to just look at the body shape. We want to know. So we are going to be doing some testing to identify it according to your case. If you want to get a consultation with me, we'll figure that out for sure. But if your hormones are out of place, you're not going to be right at all. Fitness and exercise. If you're walking your dog this way, you're not living life. You're sustaining life, because this is not the way to walk your dog. We want to make sure that we're living it. And this is what I see a lot of the times with my patients. It's sad to hear that this could be you. Let's get you back in track. But if you don't move, exercise is one of the most important things. But if we don't take care of the inflammation, pain, the arthritis, all these different things that you're dealing with, once we recover from that, now you got the ability to exercise, and we'll teach you how to get that. Longevity of life is going to be that. So I would love to really get to help you. But fitness is going to be part of your a part of your recovery. Genetics. We look at the genome. We look at mutations that your mom and dad have given you. Then maybe it's not what you're doing wrong. Maybe you just dealt genetics that are not right. Like how is your digestive? How is that the genomes of genetics or mutations affecting the digestive? How is it affecting the liver? right? Do I have depression? Do I have anxiety? How is it affecting my genetics, right? We're going to be looking at a system called the methylation system that turns on or off genetics. I tell you why genetics is huge. I spent the last 7 years of my life to really identify of how can I help my patients go even further than anything, all the way down to your genetics to figure out if your problem is coming from a mutation. Not only that, what can we do to help you? Well, we do have that. We will check your genome and we'll bring a whole different concept into your healing, into your health, into how your body is going to become healthier. Okay. So again, that's very important in genetics, guys. Those are the 5 pillars of health in which I'm going to be going over. Obviously, mentoring is important here too. But again, we got to put those together. And if you put those together, okay, that's the foundation. You can't put one off and let one off, right? You can be eating at the Garden of Eden, right? And you can exercise every day. But if your thyroid hormone's out of place, you're not going to be right. You're not going to achieve your goals. You're not going to feel good. So again, same thing with any other ones. Those pillars are missing. You're not going to stand. You're not going to be strong in your health. And as a matter of fact, this is probably the reason why you haven't gotten any better. I can almost guarantee you guys are. I can tell you guys are researchers, right? And you find out pieces by pieces. What I'm trying to do is bring those pieces together, because if you do one at a time, it will never work. This is where we're at right now. Okay, I will look at your body as a whole, not individual parts, right? And remember that 94% of people that don't have a system fail. We have a system in place that really works, guys, and we have the record to prove it. Okay, so again, my question to you is, are you willing to do something different? Are you willing? Are you ready to take action? And again, we want you to motivate yourself to take action, because that's what I want from you. Okay, you need to take action. All right, guys. Now, did this make sense? All right, let me know on the chat if this if this is motivating, because I'm going to tell you, are you interested in doing a consultation in our office? If you really want a consultation with me online or even in my office, whichever way you want to do it, and I know that if you're in Ohio, obviously we're going to be doing it online, but I have patients all the way from Atlanta, I have patients all the way from Oregon, I've got patients in North Carolina, California, all over the country, which we are really helping and putting you in place. We have everything in place for blood work, everything to really get you there, all right? So again, for a consultation, in my office, what we're going to do for a consultation is that we are going to give you 1 hour of my time, okay? Now, we just spend the last 40 minutes, 45 minutes learning something that I don't have to go over again. You have been pre-educated. And if you do come into my consultation, you're coming with a whole concept, the whole different concept of what we do here. And with hope, right? We become hopeful. I know that we can help you. All right. So again, 1 hour of my time. I am going to send you some paperwork to fill out. That's going to take you about 15 minutes. Please fill it out and immediately send it back to us, because that's what's going to dictate, in your case, what systems we need to work, how long we need to work with you, because we do the walk with you, okay? We create programs because, remember, we want to educate you. I want to make sure that you are empowered with knowledge so you can continue being healthy. I don't want my doors in my office to be a rotational door for you to come over and over and over again to get a supplement or a natural medication and all of that. No, I want you to heal and restore. That is my job. And if you're coming over and over again for the same thing, then I'm not doing my job and you're not either. So this is the reason why I'm telling you is that we do the walk, because I need to teach you and educate till you get better, right? So we'll see 3 months, 6 months, 10 months, whatever we decide to do according to this paperwork that we're going to be receiving from you, right? If you have any labs, send those with that, because give me a better picture to understand what you've been tested, what is your problem, and how can we really bring you a new solution, a new way of restoring your body. Okay, so again, those are important. Okay, in my office, what we do here, we charge $287 for my consultation for 1 hour. Okay, but for you, you've been pre-educated. What I'm going to do is I'm going to reward you. I told you that at the beginning of my presentation. I'm going to charge you $87 for 1 hour of my consultation. I want to make sure that money is not the reason why you won't want to talk to me, to really identify if I can bring something different to your table. Listen, guys, this is an incurable disease. You have nothing to lose. If anything, you get information of what's going on with you more, and that's $87. All right, I'm bringing that to your table. All right, Dr. J, is this covered by insurance? Right, typical questions that I might get. Right. Well, you know what? Whenever we don't know what test we're going to do for you, we don't know anything of that. We'll tell you about insurance. How does it cover? How do I work with insurance? We'll deal with that. And once we get into, that's what this consultation is about. How much is it, Dr. J? Well, you don't know, because I don't know your case yet, right? How long am I going to work? What labs we need to do? But at the end of the day, though, let me tell you, in our programs, if you can afford $100 to $150 a month, we can put you in a process that can start reclaiming your health, and we can make sure we'll put you in place to really recover it. Again, those are the things that I always ask for. Another question that I always get is that, hey, I'm not there. My Ohio person here is Ohio, right? Yeah, we can help you if you're not here. So again, we got everything for you guys. All right. So what I'm going to do right now is that I'm going to put on the screen. You can do this online. I'm going to put an offer, which you can really get an initial consultation with me, and you can just click on the button, and you get a calendar, right? Remember, I do get prepayments for those $87, guys. I am going to be putting what, a whole hour of my time. I'm very busy. I just put small amounts of times for you guys right now. I hope that you get some, and if you are really interested, we're very, very busy. But at the end of the day, put this schedule it as soon as you can. We're also going to be charging those $87, right? $87 is really about putting some skin in the game. I want some serious people, right? If this made sense to you and you want to change your life, that's who I want to make. If this didn't make sense to you, you know what? God bless you. Take the mythology with you, and then maybe God will bless you with your healing. But at the end of the day, I believe that if it makes sense, is to take action. Right? It's $87. That's it. You put everything online. You can schedule it. Now, if for some reason you're not getting you're cut off or you cannot get online, you can call us and we can do it online. We can do it for you. No problem at all. Okay? Again, that's very, very, very important. Now, if you have a little bit of a question now, right? So again, like I said, guys, right now is the time to do initial consultation. I'm going to remove this initial consultation right now, and we're going to put a discovery call. Okay? And the discovery call basically is more of we'll give you a call. It's going to be for about 15 minutes. It's not a consultation. I don't have time to get all your history and everything in 15 minutes, but we'll give you a time to ask questions, right? If there's any question that you might have that will make us be a good fit for you that you maybe I didn't answer the consultation. But at the end of the day, either me, myself, or just my staff will call you. We got everybody trained to do and really get all those questions answered to make sure that you're in the right direction, a great fit for you. I am going to put that discovery call right now. All right. So again, guys, for the initial consultation, call in now, tomorrow, and we get to that. But if not, just take a discovery call. Right. So discovery call. Okay, it's on the screen now. It's a 15 minutes. Same concept. You just go online. We have a whole calendar for you. Put the time that you have time. But now remember, if you put a time, please have the character to be there at that time that you scheduled it, because we are busy in our office and we are taking our time off to really provide some information for you because we care for you. We want to make sure that we provide service, right? And if we're providing our service and you put a consultation and you don't show up, then that's not the right character. We don't want that. We want to make sure that you're going to be there. We are going to call you, and we're going to. But I expect that kind of a attitude in the discovery call. Okay, and I cannot wait to talk to you guys. I hope that this made sense. Okay, I know that a lot of you guys that have participated in my chat, welcome. I love that. Terry, I know Deborah, Carlos, okay, from Dallas. Therese, Pamela, all you guys, all right? Thank you very much. Irene, Lisa, Daisy, Terry, all you guys, thank you for really talking to me on my chat. You made it a lot of fun and made things that I want to explain to people, and I'm pretty sure that I hope that you got all these answers that you needed. Talk to me. Let's get the consultation or discovery call. Okay, guys? Well, that's it for me tonight. I want to thank you again. God bless you, and we'll talk to you soon, all right? All right, well, have a good night.